Dr. Payal Kohli, our 9 News medical expert, joins us over Zoom to talk about today's announcement.
Yeah, the president said today that pregnant women should tough it out. That's a quote. But why study Tylenol in pregnancy, Dr. Kohli, and what is the link?
More than half of pregnant women have admitted to using Tylenol during their pregnancy. So it's important to explore whether there is a connection here. And what we've seen in many of the scientific studies is what's called an association, meaning the use of Tylenol during pregnancy could be a marker for autism, but that's not a causation because the women who use Tylenol may have a fever, may have an infection, may have a rheumatologic illness, may have migraines, may have other things that potentially could be associated with this. So there's a whole host of scientific literature that has not yet proven a causation, but almost the use of Tylenol could almost be like a marker potentially that could alert people to something else going on that could be related to autism.
So what's your medical advice? Because I'm sure this is scaring, right, a lot of pregnant women who may be taking a little Tylenol for a headache. So many of us did. What's your advice? Should you just stop taking Tylenol altogether? Is this link real?
No, and that is not my advice at all. In fact, the opposite. Since we have not established a causation, science has not shown that taking Tylenol causes autism. If you have pain, if you have fever, talk to your obstetrician. But for most pregnant women, the American College of Obstetrics and Gynecology, as well as the Autism Associations, are saying lowest dose of Tylenol for the least duration possible. Now, we do know that Tylenol crosses the placenta, so baby can be exposed to Tylenol. In fact, some of the studies that have looked at cord blood, where they actually look at the umbilical cord and look and see what the dose of Tylenol is in the cord blood, have shown that the higher the dose of Tylenol in the cord blood, the higher the risk of autism. But again, that's an association, not a causation. Now, it could be something else was happening with mom that made her take that Tylenol that caused that cord blood to go up. So there are a lot of unanswered questions out there, ladies, about is the timing of the exposure to Tylenol important? First trimester, second trimester, at delivery, such as with the cord blood. Is it just that we're getting confused and something else is causing autism to go up? Because there was a large study that came out of Sweden, over 2.5 million kids, that shows more autism when you compare two families to each other. But when you looked within the same family, mom took Tylenol for one child, didn't for the other child, there seemed to be no difference. The rates of autism between siblings were similar because that controls for the genetics. So I think it's really complicated out there. It's a bit too simplistic to say there's a cause and effect.
And Dr. Kohli, I know that you're really well connected within your medical community. After hearing this, I know that the official announcement's coming up, but after hearing about this, or I guess we did just hear it, what have you guys talked about? Are you able to kind of disclose any of that or just kind of generalize for us?
I think the biggest concern here that we're really worried about, Sam, is that someone yells witch and we start to burn good medicines at the stake, right? It's like a witch hunt, the Salem witch hunts. At this point, Tylenol should not be attacked and should not be blamed for autism because the science does not support that, just like vaccines are being blamed for autism. Autism is a complex, multifactorial disease. Yes, the prevalence and incidence are going up. That's partly because we're diagnosing more, partly because it might be increasing, but it's not clear that Tylenol is causing it. So what our concern is that you start to put kind of shaky science and start to make these type of conclusions. It creates a hysteria that can lead people to change behavior, that can actually lead to more worse outcomes. If pregnant women stop taking Tylenol and do worse, have a lot of pain, headaches, fevers, that could potentially even be worse for the baby. So I would say we stick to the science. We interpret the science ourselves as we do. I do want to commend the administration for trying to identify causes of autism. And I do think that taking Tylenol is a marker for a higher risk pregnancy, right? Because the people that take Tylenol, again, may have something wrong with them. But I'm not sure I'm ready to give up on Tylenol in pregnant women yet.
Well, let's put aside the Tylenol of it all. We know that the administration is looking into causes of autism. So if you were advising the White House, right, what would you tell them to study?
I would tell them to study sibling pairs, Alex, because that's really what gives us a lot of information controlling for genetics. Now, the biggest challenge in studying pregnant women and in studying babies, it's not ethical to do randomized trials. I can't say, okay, this pregnant woman gets Tylenol, this pregnant woman doesn't, because that's not an ethical type of a trial to do. And so it's hard to establish causality, because that's the best way. We establish causality. We keep everything equal and just randomize people. But if you look at siblings, that at least controls for a lot of the genetic factors as well as the environmental factors, right? Because generally siblings are exposed to the same types of food, the same types of environments. They tend to have similar genetics. And that's why that sibling study was really so remarkable. Now, a couple months ago, there was a large analysis that looked at several trials, 46 different trials. 27 of them showed the positive association, but a bunch of them, actually 9 of them, showed a null association, and 4 of them showed a protective effect of Tylenol. So that really highlights just how complicated the science is. It's not just as simple as, did you take Tylenol, was there a higher risk of autism, but really looking at a deeper dive into what some of the other factors, how we can control for those and gather more information. We do need more information because autism rates are going up, and we do need to figure out why.
All right. Well, Dr. Kohli, thank you for taking the time to weigh in. We appreciate you.